how to make a performance assessment. Start a performance assessment with planning what you exactly need in your sport. So if your sport is lying in a energy system where you need more oxidative energy, or you need more creatine phosphate ATP, your sport lies in ATP, then you need to work your test according to a plan where ATP is very dominant in the scenario. Okay, then understand if your sport is let's say has more movements where there is a direction change occurring very frequently. So if that is occurring, then you need to put some agility components in your fitness assessment. Okay, after that, start planning from resting heart rate and MHR. So resting heart rate will help you know that what their inner heart health, cardiovascular health currently is, and your assessment is going to be very crucial according to his resting heart rate and as well as his MHR, maximum heart rate. After that, make sure you test his blood, and basic analysis for blood should be the complete blood count, which is CBC. You know, need to understand the hemogram. You need to understand what hemoglobin he has. You his HbA1c is going to play a very vital role in designing his program. After that, you also need to understand, you need this marker of uric acid and CRP, that if that is going to be slightly on higher side, your program should be slightly on um, it should be volume centric, but that volume uh, should not break down his muscle fibers completely. And if they are doing so, you need to replace his carbohydrate content to recover his muscle fibers, because he cannot have excess protein in that situation, because his CRP and his uric acid is slightly on higher side. Second thing is, after that you start with postural assessment. If his posture is slightly on weirder side, he has some muscle stiffness, and if that muscle stiffness is there, his performance is anyway going to go down. So ask your physio to create a proper postural assessment for his uh, overall body structure, and start pushing his body towards it. Third thing is, you start with anthropometrial assessments, which is his fat percentage and BMR. And you, of course, most of you know that how it works in the body. Then comes is the movement screening. You can, if you have that capacity, or if you have that resource of biomechanical evaluation, the movement screening would be very easy. Then if you don't have it, ask for some biomechanic expert or a strength and conditioning expert to help them analyze what kind of single leg squat is looking like, or what kind of overhead squat in a percentage wise determination to the body weight of the athlete is looking like. Once you have movement screening, then you can go for performance enhancement assessment test, where you can check the acceleration, you can check the agility, you can check reaction, you can check explosiveness, like the broad jump test, vertical high jump test, everything you can check with in the performance assessment. And contraction of muscle fibers, you can test it with these kind of tests. Once you complete these tests, then comes the strength and endurance test, or um, what we can see is it muscle endurance test. So muscle endurance test would be something like 1 minute or 1.5 2 minutes push up test, where you are constantly checking the local muscle endurance and the lactic acid threshold of that very particular muscle. After that, in the same this thing, you can also have pull up test, or you can have abdominal crunches test, anything regarding and related to the sport. Once you complete that, then comes the cardiorespiratory test. Cardiorespiratory test would be something looking like let's say 10-kilometer run test or yo-yo test, where the athlete has to constantly run for 20 meters, and the distance between the two shuttles start gradually cutting down, and he it is basically the reverse analysis, where he starts from oxidative and he starts reaching into glycolytic to his creatine phosphate, where he has to react faster and react in a very intense situation where his body is already deprived of glycogen. Then comes is the sit and reach test, which is the flexibility test, or you can also tell your physiotherapist to make them assess your joint mobility through goniometer. Okay. And if you have extra time in your hand and if you have a resource in your hand, then you can also do performance analysis or performance assessment test specific in a second day period. So this is how a performance assessment should look like.